So we're going to start with this question. Figure A shows two bundles of the ACL. A is the larger bundle, B is the smaller. Dissected from a cadaveric knee off their bony attachments, they are labeled bundle A and bundle B respectively. Which of the following is true? I'll give you 2 seconds to look at the answers there. And the answer is 2. The tibial attachment of bundle A is anterior to bundle B. Inflection, bundle B is loose and bundle A is tight. So let's give a brief overview of the ligaments of the knee. The anterior cruciate ligament resists anterolateral displacement of the tibia on the femur. It also resists varus displacement at 0 degrees flexion. The PCL resists posterior tibial displacement, also resisting varus displacement. The LCL resists varus displacement and also resists posterolateral rotatory displacement. The popliteal ligament, as well as the posterolateral corner, resists posterolateral rotation of the tibia, and the MCL resists valgus angulation. A common test question is to quiz you on the different layers of the knee. On the lateral side, there's layer 1, which includes the IT band and the biceps femoris. The common peroneal nerve lies between layer 1 and 2. Layer 2 is the patelloretinaculum. Layer 3 has a superficial and deep component. The superficial has the LCL. The lateral geniculate artery runs between the deep and superficial layer, and the deep layer includes important structures like the popliteus, the popliteal fibular ligament, and the capsule. On the medial side, layer 1 has the sartorius and fascia. The saphenous nerve runs between layer 1 and layer 2. In layer 2, you'll have significant structures like the superficial MCL, the medial patellofemoral ligament, and the posterior oblique ligament. And layer 3 contains the deep MCL. So let's talk about the ACL briefly. The function is to prevent the anterior translation of the tibia relative to the femur. As you noticed in the quiz question there are two bundles, the anteromedial bundle and the posterolateral bundle. The anteromedial bundle is tight in both flexion and extension, and the posterolateral bundle is tight in extension and loose in flexion, and it's also responsible for preventing the pivot shift. The blood supply to the ACL is the middle geniculate artery. Often they'll quiz you on what's tight in flexion and extension for the ACL and PCL. And for the ACL, the anteromedial bundle is, again, tight in flexion. The posterolateral bundle is tight in extension. The PCL, the anterolateral bundle is tight in flexion. And the posterior bundle is tight in extension. So the way I remember this is that the anterior bundles are tight in flexion. So AF, atrial fibrillation, and PE, the posterior bundles are tight in extension. Just a little mnemonic to help remember these questions here. The PCL, the function is to prevent posterior translation of the tibia relative to the femur. It originates off the mediofemoral condyle. There are two bundles, as we just talked about, the anterolateral and the posterior medial. A common quiz question is to test you on the two ligaments that are anterior and posterior to the PCL, the ligament of Humphrey, which is anterior to the PCL, and the ligament of Risberg, which is posterior. And the way I remember this is H is before W, so anterior to posterior. Humphrey is anterior and Risberg is posterior. The blood supply is also the medial geniculate artery. The LCL, the primary function is to resist varus angulation. The origin is on the lateral femoral condyle, posterior and superior to the insertion of the popliteus. This inserts on the fibula anterior to the popliteal fibular ligament, and it's biomechanically tight in extension and lax in flexion. The posterolateral corner, it works synergistically with the PCL to control external rotation and posterior translation. And the posterolateral corner includes the LCL, the popliteus, the popliteal fibular ligament, and the lateral capsule. The MCL resists varus angulation. It works in concert with the ACL to provide restraint to axial rotation. And this originates from the mediofemoral condyle and extends down several centimeters down the medial tibia. There are two components, the superficial and deep portion. If you're doing a total knee and you're removing the medial meniscus, you know that it's attached to the deep MCL, and the deep portion of the MCL is divided into the meniscofemoral portion and the meniscotibial portions. The posterior medial corner has gained some recent traction. This is important for rotatory stability. It's formed by the insertion of the semimembranosus, the posterior oblique ligament, the oblique popliteal ligament, and the posterior capsule. And a study in the sports journal reported that if you fail to recognize injuries to the posterior medial corner, this may cause failure of your cruciate ligament reconstruction surgery. The medial patellofemoral ligament, its function is to provide restraint against lateral translation of the patella from 0 to 30 degrees of flexion. Anatomically, this lies in the second layer of the medial soft tissue complex. The sports docs, as they're reconstructing this ligament, will attach the ligament to shuttles point, which is defined by a point that's 1.3 millimeters anterior to the posterior femoral diaphyseal cortex, 2.5 millimeters distal to the posterior origin of the medial femoral condyle, and proximal to the level of the posterior point of the lumen sats line. The anterolateral ligament has recently been described as recently as 2013 by Johann Bellemans and Jan Victor in an anatomy journal. This provides rotational stability. It's attached to the lateral femoral epicondyle and inserts on the tibia, midway between Gerdy's tubercle and the head of the fibula, as you can see by that light blue pinhead on that cadaveric specimen. If you see an ACL injury X-ray, you'll often see the Sagan's fracture, and this is really the avulsion of the ALL ligament.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.